Okay, what is the difference between chronic fatigue syndrome and fibromyalgia? In my practice, if someone shows up with both chronic fatigue syndrome and fibromyalgia, my first thought is that they have chronic fatigue syndrome, because chronic fatigue syndrome is a bit more of a symptomatic diagnosis. So someone says, I'm tired all of the time. I need a lot of sleep. I need a lot of rest. I don't sleep well. I don't feel rested. I don't have energy to play. I don't have energy to exercise. I don't have energy to work. I don't have energy for relationships. I don't have energy for social engagement. It's a little bit more of that. Now, there are a lot of reasons someone can be fatigued, and that's the functional medicine fun of chronic fatigue syndrome, is figuring out the reason why. So it might be a stealth infection like Lyme disease, which is fairly complicated. It might be another kind of infection like cytomegalovirus or Epstein-Barr virus. So figuring out the reasons for the fatigue is the functional medicine sort of equation of solving problems. Okay, and maybe a hypothyroidism, like a functional hypothyroidism, might be a functional sugar handling problem. So figuring out the reasons for the chronic fatigue syndrome can help us solve the fatigue issue, but chronic fatigue syndrome itself is a little bit more defined by its symptom. I'm tired all of the time in a very significant way, and it really affects life. Fibromyalgia, if someone comes in again with both of those diagnoses, we can say, yes, pretty easily, you have chronic fatigue syndrome. With fibromyalgia, my first thought is that they've probably been misdiagnosed. They probably have they probably have chronic fatigue syndrome. They probably don't have classic fibromyalgia. They likely have a misdiagnosis of fibromyalgia, and they have fatigue, and they may have an infection. They may have a functional problem, so they might have a functional hypothyroidism. They might have a functional hypoadrenal problem. They may have a sugar handling problem, or they might have some musculoskeletal problems that are causing some body pain, like they were in a car accident and they had whiplash and they never got it treated properly. Or they fell off a ladder at home and they thought they were fine and they have lots of body aches subsequent to that fall. They didn't break anything, so they didn't go to the doctor, they didn't go anywhere. They just kind of healed and got better, but they have lots of little bumps and bruises that turned into fibrous changes in the tissue that doesn't necessarily mean that hurts. Those fibrous tissues hurt. They cause, strains and sprains in the tendons, ligaments, muscles, and they cause pain syndromes around those tissue changes. Okay, but that's not a fibromyalgia. Fibromyalgia is a disease of exclusion, or a syndrome of exclusion. So we've excluded the opportunity for them to have fallen off a ladder or been in a car accident, untreated, unsolved. They don't have functional health problems like the hypothyroidism or the hypoadrenia or the sugar handling problems. And they don't have an overt medical condition like cancer, like Lyme disease, like other stealth infections. They don't have those things. So when we exclude all of those things, we come back to a fibromyalgia diagnosis. They have a central nervous system pain processing problem or a stimulus processing problem. They over-respond to normal stimulus. And so instead of the normal response that people who don't have fibromyalgia have, they have a huge over-response. They have a 5-alarm fire every time someone pats them on the back, or they hear a loud noise, or they see bright lights. They have a huge over-response, and it's really, really hard for them to chronically have these over-responses. Their nervous system gets exhausted and really starts to sort of dismantle over time and not work well. And because 2/3 of fibromyalgia patients are misdiagnosed, it would be easy to automatically assume they've been misdiagnosed. The more difficult part is making sure that that's true, and then figuring out the reason why they don't feel well. They feel pain, they feel fatigue, among other things. And then also solving those problems from a functional medicine perspective. So really thorough health history, really thorough childhood history of physical, emotional trauma, which is always involved in fibromyalgia, classic fibromyalgia. And then food sensitivities, nutrient deficiencies, and movement therapy to get them back to normal. So the basic difference between chronic fatigue syndrome and fibromyalgia is that chronic fatigue syndrome is more of a symptom-based diagnosis, and fibromyalgia is a diagnosis of exclusion. We ruled out everything else, and it's the only thing that's left, and there are still lots of problems there. And we handle that with food sensitivity testing, nutrient deficiency testing, movement therapy, and sometimes coordinated with some medical prescription therapy, and sometimes coordinated with some psychotherapy to handle some of the past traumas, post-traumatic stuff that helped trigger the fibromyalgia in the first place.